you all received the promo, the topic for tonight is the benefits of glutathione for young adults. But I have taken the liberty to expand the title to become benefits of glutathione for adolescents and young adults, because in my research, many studies cover adolescents. One, number two, there is also the confusion of the age group of what you mean by young adults. So anyway, I'll elaborate on that later. Okay, so that was the topic originally given. So anyway, we start with introducing what is glutathione first, and most of you by now know what is glutathione, the master antioxidant or the superhero of antioxidants. And this is the glutathione molecule, and the chemical short form for glutathione or active glutathione is GSH, and the SH refers to the sulfur and hydrogen atom as shown in the diagram, and the rest of the molecule is G. Okay, what makes glutathione so special and so important is all the major functions of glutathione, which includes being the most important antioxidants for the cells and therefore the body, a very powerful anti-inflammatory agent, a very powerful immune booster and modulator, very powerful detoxifier, a potent signaling molecule, and many, many more. Because of these many functions, glutathione is essential for life. Low levels are associated with many chronic diseases, and high levels are predictive of longer lifespans. Okay, so let us then move to what are the problems, some of the problems that adolescents and young adults face, and what is the role of glutathione in this. Before we do that, let us first define what we mean by adolescents and young adults. Okay, these are some definitions. Adolescents refer to those 10 to 19 years, teenagers, of course, 13 to 19. Then with young adults, then there is more diversity in definitions. WHO defines as 20 to 24 years old. The Massachusetts Institute of Technology defines as 18 to 25. The US government defines as 18 to 24. Generally in medicine, it's taken to be from 15 to 29. And in psychology, 19 to 39. So you can see there's a wide range of definitions. WHO called young people between 10 to 24 years old as young people. That includes the adolescents plus and bordering into the young adults. Youth, WHO and UN defined as 15 to 24. All right, and for a long, long time, UMNO, not UN, huh? UMNO, UMNO, defined youth up to 40 years old, because the youth leader can be 40 years old, but the members cannot be more than 35. There was an old definition. But if you're a leader, you can be an old youth. So I think you know, all the political parties, they have their own definitions to suit their need, because some of the leaders refuse to leave. Because when they move from the youth, sometimes when they go to the main body, they might not hold positions. Okay, so there are many more definitions, but in general, when we refer to young adults, there is reference to the legal age, right? When you are of legal age, then you are expected to be an adult. But the legal age also varies from one place to another, and depends on what you mean by legal age. Is it the age of consent, meaning consent for sexual activity, or voting age, right? You can get married in some countries at 13, but you can only vote at 21, for example. Okay, but the upper limit usually is quite consistent. Young adults is generally taken to be up to 24, that is below 25. Okay, so what are some of the problems they face and what do we know about them? Okay, so this study is on the alterations in glutathione redox homeostasis among adolescents with obesity and anemia. And I want to highlight that even in this study, they discovered that the glutathione, the GSH to GSSG ratio, that is the active to the inactive ratio, or the reduced to the oxidized glutathione ratio. And GPX is glutathione peroxidase enzyme, which is the enzyme that catalyzes the action of glutathione in neutralizing free radicals, specifically the group of free radicals like escaped me already. Anyway, so in this study, it was shown that girls have higher glutathione than boys. Okay, sorry, now I remember. The free radicals are the peroxidases, okay? Glutathione peroxidase, of course. Okay, the peroxide, sorry, glutathione peroxidase, then they neutralize mainly the peroxides. So you see, girls, even from a young age, the females have higher levels of glutathione than the males, and this continues throughout life. Okay. All right. Then, so what was the conclusion of this study? The ratio of the active versus the inactive glutathione and the glutathione peroxidase activity were higher in anemic and overweight and obese subjects. So what they realized that there is a compensatory increase in the redox defense mechanisms exists in anemia and obesity among adolescents to prevent metabolic disturbances, as these conditions are associated with increased oxidative stress and inflammation. Okay, put in simpler words, they discovered that adolescents who are obese or who are anemic, right? So that means then they are at the risk of higher disease. So the body trying to protect them, will produce, will increase the level of protection, antioxidant protection, by increasing glutathione, active glutathione, and resulting in a better ratio of active glutathione to inactive glutathione, and increased activity of the enzyme glutathione peroxidase. Okay, so my comment is this compensatory defense will become less with age. Now remember, well, we know, and we will discuss it later, that after age 20, the glutathione production declines. So this protection will also decline. And health problems may then start to appear, right? The protection is not forever. The protection is only there when they're young, when their glutathione production is tip-top. Okay, anemic and obese adults do end up with many health issues. Okay, so anemic and obese adolescents, they are protected by their high production of glutathione. But as they grow older, they move to become young adults, the protection starts to become less. When they become adults and old adults, then the protection will be much less. Next, the study shows that higher glutathione peroxidase activity in physically active adolescent females exists in comparison with healthy sedentary controls. Okay, so one, if the adolescents who are anemic and younger, they have higher peroxidase activity and also higher GSH to GSSG ratios. Then this study shows that same thing happens in adolescent females who exercise or who are active, physically active, compared this to those who are not. These findings indicate that serum glutathione peroxidase is higher in gymnasts and would suggest that regular intense exercise may enhance antioxidant status. This outcome, in turn, may help to protect against degenerative diseases and preserve bone health by preventing free radical-induced bone resorption. Okay, it is a known fact that the thinning of bone and the resorption of bone and the refashioning of bone is done through free radical release by the osteoclast, the cells that resorb bone. And when we talk about osteoporosis or osteopenia in menopause, right? Previously, I had also mentioned that glutathione plays a very important role in protecting older women from osteoporosis. Okay, so in younger girls, glutathione plays an important role in strengthening the bones. Right? At this age, it is about building up the bones. Right? At the menopause, it is about reducing the weakening of the bones. So my comment on this study is the higher glutathione peroxidase activity requires more glutathione to act as a substrate. Remember, GPX is the enzyme. It works on glutathione. Higher activity means higher glutathione is required. So it would be good to boost glutathione as insurance if the young adolescent or adult is very active in exercise and sports, especially if involved in competitive sports. Okay, because while we say that when they're young, their glutathione production is tip-top, there's also a limit. Yeah, there's also a limit. So if they are very aggressive in sports, especially competitive sports, right? Then the body's production may still hit the ceiling and the protection may start to go, and therefore it makes sense to supplement in these cases to make sure that the glutathione supply is always good. Another study, a pilot study of cortical glutathione in youth with depression. This cortical means the cortex of the brain. Okay, so they measure using sophisticated machines and not by blood. Okay, and what did they find? Conclusion: although preliminary, findings add new data to support the role of oxidative stress in major depressive disorders and suggest that lower glutathione may be a potential marker of major depressive disorders early on in the course of illness. Okay, and nowadays especially, there's a noticeable increase in young people having depression and anxiety and all sorts of psychiatric problems. Okay, I don't blame them because their parents are also cuckoo nowadays. Yeah. Okay. Next, we look at cortical glutathione levels in young people with bipolar disorder. A pilot study using magnetic resonance spectroscopy. That's how they measure, yeah, the glutathione. So conclusion: this pilot study suggests that levels of cortical glutathione are unlikely to be useful trait biomarker of bipolar disorder in young people with a history of relatively mild instability at an early stage of illness. However, lowered glutathione levels may be relevant to bipolar pathophysiology in more severely ill patients, particularly those with significant current mood disturbances. Okay, so they found out that in mild cases, right, then they didn't detect difference in glutathione, but in the severe cases, yes. Okay, so the studies show that glutathione is very much involved in brain function, very much involved in psychiatric disorders, right? So just now, the first one was on depression, second one is on bipolar disorder. So right, if mild, okay, you don't detect the difference in glutathione, but with severe cases, yes. Okay, next we go to paracetamol poisoning. You know, you have depressed, anxiety, and then all sorts of problem, and many adolescents, young adults, they go and take overdose of Panadol or paracetamol. Correct. Plus other drugs. But paracetamol is very common because it's so easily available. So this study is on adolescents to see the effect of paracetamol on their liver. Okay, conclusion: increases in the rate of glutathione synthesis and the ability to stimulate glutathione production in response to acute depletion in children, right, might explain their decreased susceptibility to paracetamol. The Americans call it acetaminophen. We call it paracetamol, right? The decreased susceptibility to paracetamol hepatotoxicity, meaning these children and adolescents and young adults tend to be quite resistant to paracetamol poisoning because of the ability to produce lots of glutathione. But adults don't have that advantage. So paracetamol poisoning seems to be more dangerous to adults than to younger children. What about diabetes type 1? So in adolescents and young adult, you see diabetes type 1 because diabetes type 2 is usually a problem of older people. But the trend is for diabetes type 2 to affect younger and younger people, including adolescents, especially in the Arab countries there, because of in the past you only see obese, poor lifestyle, all that in older people, but now they start earlier and they get type 2 also earlier, including in young adults. So for type 1 diabetes, the investigators found that in poorly controlled diabetic teenagers, glutathione was low, not because its production was decreased, but because it was used at an excessive rate. Okay, so earlier on, I mentioned that yes, in the young people, their production is usually sufficient, and they can even increase it to a higher level as needed, but there is a limit. Okay, so when they are in a condition where the consumption of glutathione is very high and exceeds the limit, then they start having low glutathione levels. Okay, so in this case, so type 1 diabetes, if poorly controlled, they still end up with having low glutathione despite the high production because of the high consumption rate. The body tries to protect the organs from damage due to the hyperglycemia and the resultant high oxidative stress. A lot of glutathione is consumed. And it was found that glutathione is reciprocally related to glycemic control, meaning poor glycemic control means low glutathione. High glucose, low glutathione. Normal glucose, normal glutathione. Low glucose is high glutathione because less consumption. Okay, next is on cystic fibrosis. This is a genetic disease affecting the lungs, mainly because of the genetic defect. Then the sufferers have very thick mucus that will cause them lots of problems. Cystic fibrosis is associated with a chronic inflammatory reaction and an overabundance of oxidants relative to antioxidants. So you end up with oxidative stress. Glutathione functions as a major frontline defense against the buildup of oxidants in the lungs. Oxidants also equals free radicals and so maintaining optimal levels of glutathione can counteract the deleterious effects of oxidative stress in the lungs in cystic fibrosis. So this is long known, and glutathione, boosting glutathione in various ways is one of the standard treatments for cystic fibrosis, and also standard treatment for thick mucus in other conditions, right? Whenever you have thick mucus, you boost your glutathione, then the mucus will become less thick. Next, right, young girls and nowadays young boys also want to whiten their skin using glutathione, and for many years glutathione supplements have been used for skin whitening. So what are the facts, the myths, and the evidence about glutathione and skin whitening? Glutathione's skin lightening effects result from direct as well as indirect inhibition of the tyrosine enzyme and switching from eumelanin to pheomelanin production. Okay, tyrosine enzyme is involved in the production of melanin. That's the pigment that makes us dark. So currently, there are 3 randomized controlled trials that support the skin lightening effect, meaning it is a fact, right? It is a fact that boosting glutathione can make your skin healthier and fairer. What about acne? Okay, also a common adolescent problem, right? Adolescent young adult. So a decrease in glutathione may be involved in the pathogenesis of acne vulgaris, meaning now the focusing on the etiology, on the cause of acne, pimples, having low levels of glutathione. So the study concluded that a decline in antioxidative activity led by a decrease in glutathione quantity may play an important role in pathogenesis of acne vulgaris. So mostly these young people, meaning in these young people, a decline in glutathione could be the reason why they are predisposed to acne. You know, not everybody gets acne. There are many factors. You look into the diet, you look into their hygiene, you look into their hormones, you look even into their emotional state, you look also on their susceptibility to infections by certain bacteria. Okay, and now they discovered that the level of glutathione also may be one of those factors. What about COVID-19? Children and adolescents with COVID-19, they reduced and oxidized glutathione and their ratios. And this is what they found. In 7 to 11-year-olds with COVID-19, there was a pronounced glutathione deficiency in 86% of cases, with higher oxidized glutathione values and lower reduced to oxidized glutathione ratio. Okay, so, and then in the next higher group, 12 to 18 years old, the situation was not that bad as in the youngest group. And then older group, 19 to 21, the situation worse again. So that's not consistent. But the point is, in all groups, glutathione levels were reduced, right? And the ratio of active to inactive glutathiones was also reduced. Whereas we've always said that young people below 20, they have sufficient glutathione. So COVID-19 in children is accompanied by lower values of glutathione. There is a possibility that those who are susceptible to infection started with having lower levels. Yeah? But certainly once they get COVID-19, almost everybody, right, in those percentages, many ended up with lower glutathione because glutathione is used by the body to fight the COVID virus and all the complications brought by the COVID virus. That is the cytokine storm, the inflammation, and the free radicals. Okay. So we know if you have lower glutathione, you're more susceptible. But then if you get COVID, then you end up with low glutathione. So if you want to recover and you want to avoid long COVID, make sure you have high levels. And even this also apply to children. The study shows that they end up with having low levels of glutathione. Okay, not just low, deficient levels. Low can mean within normal, but lower levels, right? Deficient means lacking glutathione. Okay, and the most surprising study is this. Serum glutathione in adolescent males predicts the parents' coronary heart disease. And this is this is a study in a peer-reviewed journal, Circulation. I was shocked by this. What? Okay. So if you want to reduce your coronary heart disease, make sure your adolescent children have high glutathione. Okay. I don't know how to explain this, but they found this, and it's significant. It's significant. The finding was significant. Okay. Right? So low total glutathione in adolescent boys is a significant independent predictor of parental coronary heart disease, in addition to elevated LDL cholesterol, low HDL cholesterol, and elevated total serum homocysteine concentration. Those are the classical risk factors. But now you have to add this. You have to check your adolescent boys' level of glutathione and add to your risk. All right. One possible explanation is this. For young boys to have low glutathione, then most probably there is some defect in the genes that control glutathione production. Because normally they have normal levels and they have capacity to produce more when required. Okay, so only three conditions which will come next that can explain low levels. One is genetic defect. Two is then they end up with diseases which then consume high consumption of glutathione. Three is extremely poor diet where the protein intake is so low that the precursors are not there. Okay, so barring the two, in so-called normal adolescent boys having low total glutathione, the most likely is there some genetic effect. Therefore, it's also likely that the parents have the same genetic effect. That means the parents, when they were young and continue until when they're older, so the parents also have been having low glutathiones right from when they were young. Right? If you have a deficiency glutathione, innate deficiency of glutathione when you're young, you're going to have problems when you go old, because those who have healthy levels when they're young also have reduced levels when they go old. Right? So if you think about that, we're not surprised then the risk of coronary heart disease increases, because glutathione is a potent protector of heart health. Okay, but if you extrapolate, it's not just about coronary heart disease. All the organs also are at risk of premature aging and disease, because glutathione is a main protector of all the organs. Okay, so as mentioned earlier on, glutathione production before age 20 is usually sufficient, except for those three conditions that I mentioned just now. Okay, another one classic example of genetic abnormalities involving glutathione synthesis and all of the enzyme system is in the autism and autism spectrum disorders. Children and adults who suffer from this. Okay, so many, because when investigated, many were found to have genetic abnormalities resulting in having low glutathione levels. So much so that glutathione, some doctors treating autism boost glutathione as part of their treatment. So in general, healthy children, adolescents, and young adults do not need to boost glutathione production, but those who fall into the above three categories need to boost glutathione. Right? So you cannot put a blanket say, as long as you're young, you don't need glutathione. we know of many cases now, right? The studies have shown if your child has depression, if your child has a severe bipolar disease, or maybe we extrapolate to anxiety, right? Then maybe they will benefit from boosting glutathione. What happens after age of 20 is that the glutathione levels start to go down and down and down by 10 to 15% every decade as part of our programmed aging, and that will result in increased oxidative stress, reduced immunity, increased toxicity, what else? And all the things that are involved, that glutathione involved in, will be affected. Okay. So how to increase glutathione? Unfortunately, we know that glutathione taken orally is not well absorbed. Orally means either from diet or glutathione supplements. So the way to increase glutathione is to supplement with glutathione precursors, that is the building blocks of glutathione, which are glutamic acid, cysteine, and glycine. But the most important precursor is cysteine because it is the least available. It is also the most fragile of the 3 amino acids. The best source of stable cysteine is ribosine, which is actually ribocysteine, trademarked as ribosine by Max International, which is the innovator of this molecule. So what is ribosine? Right? It is a D-ribose L-cysteine shortened to ribocysteine and trademarked as ribosine. The stable cysteine then can be easily absorbed and then made available in the cells to make glutathione, while the ribose, which is used to stabilize the cysteine, is then made available to make ATP, and ATP is energy carrying molecule of the body. So you also have enhanced ATP production in addition to the enhanced glutathione production, and ATP is also needed to for the glutathione synthesis too. So that probably explains why ribosine is 300% better than the next best glutathione precursor, which is NAC or N-acetylcysteine. So Max International has two products that are powered by ribosine. One is Max1, which is 100% ribosine, and the other one is Celgevity, which is ribosine plus 12 other ingredients, which are blended together to enhance the development of glutathione and also have their own health benefits, many of which are anti-aging. So Celgevity is an anti-aging powerhouse. To summarize, glutathione is a tripeptide with many important functions essential for life and for good health. Glutathione production is usually sufficient in adolescents and young adults, but there are exceptions. Young people with high glutathione utilization, example, those who are very active in exercise and sports, or have low glutathione levels because of various health problems, should boost glutathione to maintain or improve their health. Glutathione production declines rapidly after age 20, and boosting glutathione becomes more important for those with low glutathione earlier, and even for healthy people. Okay, so if when you're young you have low glutathione, then when you're older you really need to boost your glutathione, because even those who have healthy levels of glutathione when they're young need to boost when they're older. Dietary and supplementary glutathione is not well absorbed, so the best way to boost glutathione is by taking glutathione precursor supplements. And the most efficient glutathione precursor supplement is ribocysteine, trademarked as ribosine, which is the main ingredient in Max1 and Celgevity. Thank you very much.